Hello, welcome back to Ocular Vitus Med, where we connect the dots between your systemic health and the back of your eyes. I'm so glad you are here with me today. But before we dive in, I want to ask you a serious question. What if I told you that a routine eye examination could catch diabetes before a standard blood test does? It sounds shocking, but it happens in clinics, in hospitals all over the world every single day. Today, we are going to break down exactly how diabetes attacks your vision, what is happening under the surface, and how you can protect your sight. So, let's start by defining diabetes. What is diabetes? To understand how diabetes affects the eyes, we first need to understand what diabetes actually is. So diabetes is a chronic metabolic condition where your body either cannot produce enough insulin or cannot effectively use the insulin it makes. What is insulin, we might be asking? So insulin is like a microscopic key. Its job is to unlock your body's cells so that glucose, the sugar from the food you eat, can leave your bloodstream and enter the cells to give you energy. Without that insulin key working properly, sugar gets trapped. It piles up in the bloodstream, causing your blood glucose level to skyrocket. Now, there are three primary types of diabetes that you should know. We have the type 1 diabetes, we have the type 2 diabetes, and we have gestational diabetes. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys the insulin-producing cells in the pancreas. Because the body produces zero insulin, these patients require daily insulin injections to survive. And now the type 2 diabetes. This is far more common and is largely driven by insulin resistance. In this type, the pancreas makes insulin, but the body's cells become numb to it. In simple terms, we can say that the key is no longer fitting the lock properly. Over time, the pancreas gets exhausted and blood sugar levels climbs. And then the third one is gestational diabetes. This develops strictly during pregnancy, where hormones from the placenta block the mother's insulin, causing high blood sugar. While it usually resolves after giving birth, it significantly increases the risk of developing type 2 diabetes later in life. So even though I specialize in the human eyes, managing these systemic types is critical because all of them result in the exact same danger: too much sugar flowing through your blood vessels. Okay, now let's transition to the human eyes. So how does blood sugar in your arm end up causing blindness in your eyes? Does it make sense? But I'll tell you how. When your blood is constantly flooded with sugar, it becomes chemically toxic to the walls of your tiniest blood vessels called capillaries. Now, the retina, the delicate, light-sensitive layer of tissues at the back of your eyes that acts like the film in a camera, is packed with millions of these microscopic vessels. And when high blood sugar damages these vessels, it leads to a disease called diabetic retinopathy. So let's break this into stages. The first stage is called non-proliferative diabetic retinopathy, or NPDR. So let's think of non-proliferative simply as not growing yet. This is the early stage of the disease. Let's remember our garden hose analogy. Imagine the tiny blood vessels in your retina are like tiny rubber garden hoses. Chronic high sugar weakens the rubber walls of these pulses. So under pressure, the weak spots begin to balloon outward, forming tiny pouches we call macroaneurysms. Eventually, these weak spots pop and they begin to leak fluid, fat, and blood directly into the layers of your retina. And when we look inside your eyes, we see these as dot blot hemorrhages and hard exudates, which are just the fatty residue left behind by leaking plasma. So as small vessels shut down, patches of your retina lose their blood supply and start to suffocate from a lack of oxygen. This causes micro strokes in the retina, visible to an eye specialist as fluffy white patches called cottonwool spots. So the next stage is what we call the proliferative diabetic retinopathy. So what happens here is, if the non-proliferative diabetic retinopathy is left unchecked, it evolves into an advanced dangerous stage known as the proliferative diabetic retinopathy, or the PDR. The word proliferative means to grow rapidly, and that is exactly what happens. So because large areas of your retina are now suffocating and starving for oxygen, the eye panics. In a desperate attempt to save itself, the retina releases a distress signal, a chemical that we call the vascular endothelial growth factor, also known as the VEGF. Now, this VEGF signals the eye to rapidly sprout new blood vessels to restore oxygen flow. This sounds like a good thing, right? But it isn't. These new blood vessels are abnormal, widely fragile, and poorly constructed, as in they grow out of control along the surface of your retina and into the gel of the eye. So because they are so weak, they rupture easily. They can completely fill the inside of your eye with blood, a condition called vitreous hemorrhage, which instantly blocks your vision. It's just like black ink poured into a glass. Even worse, as these abnormal vessels scars, like they can pull on your retina, physically tearing it away from the back of the eye. This is a tractional retinal detachment, and it is a major medical emergency. Also, diabetes can also cause diabetic macular edema, DME. And alongside these stages, this is what diabetes can also cause, macular edema, where the macula, that is the center dark part of your retina, responsible for your sharp, straight ahead vision, the vision you use to read, the vision you use to drive and recognize faces. What happens in this case is that when the vessels near the macula leak, the center of your vision becomes waterlogged and swells up. When the macula swells, your straight lines start to look wavy while reading, and your central vision goes blurry. But here is the most critical takeaway from this, and I want you to listen carefully. In the early and moderate stages of diabetic retinopathy, there are absolutely zero symptoms. You can have microaneurysms popping and vessels leaking in your eye right now while enjoying perfect 20/20 vision. You will not feel pain and you will not notice a change until the fluid hits the very center of your sight. And by the time your vision goes blurry, the structural damage is already advanced. So we might be asking, what's the treatment or the action plan, what to do? Yes, there's a good news, and it is entirely preventable. So modern medicine has incredible ways to stop this disease in its tracks if we catch it early. The anti-VEGF injections, remember the VEGF I talked about, initially. So we have the anti-VEGF injections, and this is done by using specialized medications that is injected painlessly into the eye to block that distress chemical drying up and the leaks, and then making those abnormal vessels shrink away. There's a laser therapy where targeted lasers are used to seal leaking blood vessels and preserve your central vision. So what you need to know is, in a case of diabetic retinopathy, the ultimate cure is systemic control. Yeah. So you need to work with your doctor to mind your diet, and then go for a routine, detailed eye examinations. So if you or a loved one has diabetes, an annual dilated eye examination is absolutely non-negotiable. Don't wait for your vision to change to check the vitals of your eyes. Okay? So thank you so much for watching on Ocular Vitals Med. And if you find this explanation helpful, please hit that subscribe button, share this video with someone who needs to hear this, and drop any questions you have in the comment section below. Let's keep our vision clear and our bodies healthy. I'll see you in the next video. Bye.